a hospital. The interlocutor is me, Alisha, and the candidate is Milna. So let us start the role play with some warm-up questions. Please introduce yourself.
My name is Milna. I'm a nurse by profession and I have completed my graduation from Rajiv Gandhi University of Health Sciences, Karnataka.
Okay. Why did you choose nursing?
Actually, nursing is a noble and service-oriented profession, and it was my long-term ambition to work as a registered nurse. Other than that, my sister is also a nurse, and she used to discuss me regarding her daily duties and the care that she gave to her patients, and that inspired me a lot. And these all are the main reasons why I chose this field.
Okay, good. What are the risks involved in nursing?
First of all, nursing is a risky field, and there are so many risks to nurses with this profession. The first and main important risk is getting of needle prick injury and also getting some communicable and other diseases like HIV, TB and so on by contacting with body fluids of the patients. Other than that, getting of back pain and radiation exposure is also a some risk.
Okay, so that is the end of your warm-up session, and this will be a role play card. Your 3 minutes for preparation starts now.
Thank you.
So this is the end of your preparation time.
Okay.
So please begin the role play.
Good morning, Miss Alice.
Good morning.
You might have remembered me. Let me remind you my name. My name is Milna. I am one of the registered nurses working in this hospital ward. So, is this the right time to talk to you, Miss Alice?
Yes.
Thank you for your permission, Miss Alice. Today, I am here to discuss you regarding your discharge plan. How are you feeling about this discharge?
Discharge for me today?
Yes.
Nurse, I think that it's very early to get discharged from this hospital, and I am not feeling well right now.
Miss Alice, I can really understand your situation. May I know the reason behind your decision now?
Yes, of course. See, nurse, I admitted here because I have fainting, and now I think that I am not feeling well. That's why I am too anxious about this early discharge.
Alice, I can really understand your situation, but I can explain you why we have planned this discharge to you now. May I proceed with that?
Yes, nurse.
Alright, so Miss Alice, this discharge decision was made by our hospital multidisciplinary team according to their satisfactory assessment on you. So now there is no any danger to your health, and this is the right time to make a discharge to you. Am I clear so far?
Yes.
Before this discharge, I would like to ask you some questions about your aftercare. Is that okay for you if I ask you some questions?
Yes, nurse.
Alright, first of all, do you have a BP apparatus at home?
Yes, I have one at my home.
Alright, and do you have any idea about how to measure your BP?
Yes, of course. Actually, the doctor had explained me regarding when and how to monitor my blood pressure, but now I think that I can't remember still now.
Please don't worry, Miss Alice. I can explain you regarding how to measure your BP at home. Is that okay for you?
Yes, nurse. Thank you.
Alright. So, as you have said that you have a BP apparatus at home, may I know whether it is an electronic BP apparatus?
Yes, it's an electronic one.
Alright. So, on your BP apparatus, you can see a cuff on that. So, it should be tied on your hand above the knee level. After tying that, you can see a start button on that BP apparatus. Please press that button, and within seconds you can see a automatic reading on that monitor. Am I clear to you?
Yes.
Alright, so that will be the accurate reading of your BP. And please make sure that you are documenting all these readings on a book or something else, and it should be carried for your next follow-up. Are you on the same page, Miss Alice?
Yes, nurse.
Alright, so coming to this measurement, it is very beneficial for you to measure your BP twice daily. That means if you measure your BP on today 6 a.m., it should be repeated on the evening 6 p.m. Am I clear to you?
Yes, nurse.
Alright, and it is very imperative for you to continue this for the next 1 week. And now may I know whether you have any other concerns to clarify with?
Yes, nurse. Actually, if I get any abnormal readings, then what should I do?
Miss Alice, your concerns are really reasonable. Before relieving your concern, I would like to discuss you regarding the normal BP reading. So a normal BP reading is considered as about 120 over 80 mmHg. So if it exceeds or precedes within the limit, it will be considered as an abnormal BP. So if you get an abnormal reading, that means above 120 over 80 or below 120 over 80, it is very imperative for you to contact your doctor and to discuss all your worries with him, and he will provide appropriate management for that. Am I clear?
Yes, nurse.
Alright. So Miss Alice, I would like to ask you some questions. Is that okay?
Yes, proceed.
Do you have any family members or any neighbors lives nearby, or is there anyone else at home to take care of you after this discharge?
Actually, I am living with my family and there is my spouse and he will be looking after me.
Alright, thank you for the information, Miss Alice. So, after this information, I would like to tell you that this supportive network is very important for you. As you know, you have an episode of fainting. So, if you feel in a type of fainting episode after this discharge, it is very imperative for you to seek help from your family members or from the neighbors. So, I hope I am clear.
Yes.
Alright. Do you have any more concerns, or is there anything else you would like to share with me?
Yes, nurse. When I have to come for the next appointment?
That is a very reasonable question, Miss Alice. So there is a review appointment scheduled for you after 1 week. So at that time you can come to this hospital and you can see the doctor. And please make sure that you are bringing your this BP readings with you at the next visit, and you can discuss all your worries or concerns with him at that time. So I hope I have clarified all your concerns. Is that right?
Yes.
Okay, so Miss Alice, if you have any other concerns or queries regarding this discharge or about your aftercare, definitely you can contact me at any time. I will be available in this hospital itself, and for your reference I can provide you a leaflet which contains all the information regarding this condition and also about the management. So below that leaflet you can see a contact number. You can contact with me if you have any other queries. Thank you for your active listening, Miss Alice.